This is the posterior apprehension test. Posterior dislocations of the glenohumeral joint are much less common than anterior, but they do happen, especially with car wrecks and offensive linemen. Because in both car wrecks and offensive linemen, they receive a blow to a straight arm, which forces the glenohumeral joint posteriorly. So with that in mind, we are going to recreate the mechanism of injury. Now, with this one, I have her arm off of the table. You want to make sure you have some clearance, because if they're up against the table here, it won't allow posterior translation. And you want to allow that posterior translation to see if they're apprehensive. Let's say you can't get them off of the table. You can get an object like this, place underneath the shoulder blade, and that will allow you to have that motion in the glenohumeral joint. However you position them, just make sure this joint is clear and can move. So what you're going to do is apply an axial load through the elbow. Your other hand will be here, but not to compress or stabilize the joint. What you're going to have the other hand here for is to see if you can feel the translation when it occurs. So you have them in this position, apply the axial load. You can see there's some translation with her as I press down, but it's not a big gapping, and it's about what I would consider normal. So just like the apprehension for anterior, she would say that she doesn't want you to continue pressing, or you would feel that shift posteriorly.